The family of a 14-year-old girl in China who died after she was put in a COVID quarantine center are demanding justice, saying their calls for medical help were ignored. Guo Jingjin, 14, developed a fever 2 days after being taken to the center in Ruzhou, Hunan province last Friday. Videos of her shaking and convulsing on a bed sparked an outcry online in China, which retains strict pandemic controls. Her family had shared the clips, appealing for help and accountability. Officials contacted by the BBC have yet to comment on the allegations or the cause of Guo Jingjin's death, which remains unclear. In his video, her father Guo Lele said workers at the center had failed to provide any treatment to Jingjin as her condition worsened. On Sunday, she had begun to convulse, dehydrated and shaking, he said in a video uploaded to Douyin, China's local version of TikTok. Health workers at the center took no care of her, no one even inquired, he said in the video, which was widely shared before censors took it down in some places. Mr. Guo's video and another uploaded by Jingjin's aunt calling for justice have been increasingly censored in the past 48 hours. I'm requesting the Central Committee of the Chinese Communist Party and Discipline Inspection Commission come down to investigate the Ruzhou government's neglect and give my daughter's life back, he said, in a video which shows him next to his daughter's body. The BBC has confirmed Jingjin's death and the circumstances surrounding it with a separate member of the family. They confirmed that the 9th grader's condition had swiftly deteriorated on Monday afternoon and she was taken to Ruzhou No. 4 hospital that evening. However, she was in a critical condition by then and could not be saved. Jingjin's death and the circumstances surrounding it have triggered an outpouring online, with people expressing anger over her treatment and criticizing President Xi Jinping's COVID policies, which are unpopular with many people in China. I'm so angry. Why didn't they just give her a medicine pill, one user wrote. Another said, it's always like this. Nothing will ever change. Some referenced a bus crash in September, where 27 people were killed as they were being ferried to a quarantine facility. However, the case has not been reported in Chinese media, which some users attributed to a media blackout during an important Communist Party Congress this week at which Mr. Xi's tenure is expected to be extended. Zero COVID holds danger for China. Xi. China's elderly suffer in COVID quarantine centers. Ruzhou city officials are yet to issue an official comment. A spokesman told the BBC on Thursday he was personally aware of the case but had no official comment from his superiors. Local Communist Party officials also declined to respond to BBC inquiries, saying, "Please wait for an official announcement." China's COVID rules demand that anyone who is infected or a close contact must be sent to a state-run quarantine center. It's not clear if Jingjin had COVID or if she had been placed in the quarantine site because she was a contact. The relative said Jingjin had been taken to a quarantine center, set up in a local school, and placed in a separate building to her father. Hundreds of other children are being held in such centers across the region, with many separated from their families. The BBC has heard from 4 other families who say they've been separated from their children as young as 7 and 8 who are in quarantine on their own in various facilities. One mother, a Mrs. Liu, told the BBC her 12-year-old son was scared and suffering after days in a center. My child cannot stand it anymore. Authorities, are not letting them return. He's such a small kid, he cannot deal with being alone in one room for such a long time, she told the BBC. Another parent, Mr. Zhu, told the BBC he and other parents were even more alarmed after hearing about Jingjin's death. Parents have told the BBC they are extremely concerned over the conditions and the lack of proper care for minors in the facilities. Such centers have become known for their lack of staff and resources.